But for now, let me introduce our second speaker, who is Constantine Boussalis. I will say that in the Greek way that I know. He's Assistant Professor in Environmental Politics and Quantitative Methods, also in the Department of Political Science at Trinity College Dublin. His work focuses on climate change communication, specifically origins and impact on public opinion and policymaking, and he uses computational methods to study political communication. He's currently working for the European NORFACE network on a project on extreme identities, and will present to us his perspective on COVID-19 and democracy today. To you.
Okay, can everyone hear me? Okay, sorry about that. I'm so sorry. Okay, so hopefully you'll be able to see my screen. Okay, so wasting 30 seconds right there. Sorry about that. So I'll be presenting some preliminary work that I'm conducting with Stefan Bale, Travis Cohen, and Laszlo Horvath from Exeter on how the media is covering COVID-19 pandemic. And so in this presentation, even though we're doing a larger study looking at the US and the UK, in this study, we'll be looking at, I'll be discussing the US only. So just a brief introduction, the COVID pandemic is showing how adequate policy responses are and public behavior and changes in public behavior is crucial for limiting fatalities. One of the key determinants of these responses and behaviors, in our view, is how the disease is represented or framed by major news media. And when we talk about a frame, we're saying a frame is typically understood as a central organizing idea or study or storyline that provides meaning to an unfolding strip of events. So framing can be understood as a strategic tool used to emphasize or obscure certain aspects of perceived reality in order to promote a particular interpretation of an issue. So there is past research on framing of epidemics. Notably, the focus has been on the HIV/AIDS, Ebola, and there's also some more recent work on SARS that we can draw on in terms of understanding what frames have emerged when the media are discussing epidemics, and also the dynamics of these frames. So what can we learn from past research? Well, first is that epidemics are framed in different ways, and 5 frames are generally emerge when the media discuss pandemics. These 5 are that it's purely a scientific, technical, medical issue, or that this is a public health policy challenge. These are very familiar to us now today, I believe. But also they're frames that kind of discuss the crystallization of pre-existing human rights or development problems, or that the pandemic is posing a fundamental or national security threat, or even, and this is probably more, common for the HIV/AIDS coverage, but that there's some type of moral panic here, that there's a deviant subpopulation that's responsible somehow for the epidemic. This is also, we also see this a little bit with Ebola, but the scholarship on SARS and Ebola also have emphasized the frame that this is a quote unquote foreign disease, that this epidemic is a result from inferior practices, say, of a foreign region or foreign culture. Another key finding from this literature is that framing in the news varies on political line of an outlet and also by the type of outlet as well. So that's the first finding. The second is that the framing of epidemics can impact public public perceptions and also policy making. So framing of a health issue in one way or another can have potentially serious negative consequences on these outcomes. So for instance, in the literature, there's been discussions on how the security or the foreign frames that we discussed, that I just previously mentioned, can have actual impacts on pragmatic and normative grounds. So for instance, if there's a focus on the security aspects of the pandemic, this can lead to restrictions on fundamental liberties that can outlive the epidemic. And I'm sure that we'll be discussing this more in depth in this panel. But also there can be a shift towards preferences for short-term responses that that overlook kind of tackling structural roots of the epidemic's long-term negative impacts. The third finding from the past research is that framing can shift dramatically as the epidemic unfolds. And so what I mentioned here is that there are pivotal moments that have been shown to trigger framing shifts in the past. So if we take an example from Ebola, Gerlach mentions how the Western media in the author's content analysis shifted from a discussion or framing of preventative measures quickly to preemptive measures when Western countries began to be exposed to the epidemic. So the discussion or the framing typically began with kind of the outbreak is a result of quote unquote primitive African practices, which then led to an emphasis on kind of technical solutions and humanitarian aid to be sent to these foreign regions. And but this quickly shifted to a need for robust Western government intervention and medical action, robust biosecurity on the side of the Western countries, for instance, flight bans, and also discussions of global species networks, etc. So it becomes a systemic issue. In this I'm going to be showing preliminary findings here. What we're interested in is kind of seeing if these frames, to what extent they are prevalent in the current context in COVID-19, and also looking at a diachronic analysis of the major frames in the US news media, and potentially looking at locating shifting points and highlighting differences across outlets. So two kind of preliminary questions here: are there differences in framings by outlet in the United States? And do we observe noticeable shifts in framing over time? So we collected all online news articles mentioning coronavirus or COVID that were published on most popular US news domains between the period December 2019 and April 2020. This returned a little over 82,000 news articles. Here's the outlets. The outlets that we're looking at varies by type and by ideology. From newspapers, we have Washington Post, Wall Street Journal, USA Today, New York Post. We also have online articles from television outlets, Fox News, CNN, ABC, NBC, CBS. We also have radio, which is National Public Radio, and also we have an online-only outlet, Breitbart, which is if you're not familiar with it, is a kind of very right-wing outlet. So I'll be discussing two different methodological approaches that we do to kind of measure these frames, the existence of the frames. The first is a topic modeling approach. This is an unsupervised machine learning model that's applied to this corpus. And here we're able to uncover the latent themes that run through this corpus. We can discuss this in the Q&A, but we argue that these underlying themes that are generated by the LDA model can be interpreted as representations of distinct media frames. We generate 56 topics from this model that are then mapped onto these larger frames that I just discussed. Also, we look at the word co-occurrence networks from sentences in this corpus that explicitly mention the coronavirus. And here we're trying to get at a more granular framing of the discourse. So I'll quickly pass through here. This is just I want to discuss the mappings of these topics. So basically the takeaway here is that of these 6 prior frames that were found to be prevalent when discussing pandemics, we can only really map on topics to 4 of them, and here they're listed. I'm not going to spend more time here, but in the Q&A, if you're interested, why don't we see, say, this foreign disease, which anecdotally, we all know that right-wing outlets in the United States definitely do discuss this. This is probably a limitation of the LDA model, but also perhaps a limitation of our, or basically more work is needed. But we also find these new frames as well. So an economic shock frame, or a social shock, or global challenge, or even political tensions emerge as frames in our analysis. And this, I think, speaks to the fact that how systemic this crisis is, and the challenges that it poses. So here's here are some preliminary findings from the topic modeling analysis. So the way to read this is just basically that we have multiple outlets here that I mentioned. And here is for any given week from January to April. This would be if you were to pick up an average article from this outlet, what proportion of the words in that article would be attributed to this frame here. So what we can see here is that a very large percentage of the words discussing coronavirus had to do with medical problem frame in the beginning of the crisis, but that this basically tapers down as time goes on. Although I should mention that even at the current level of 10%, that's quite high actually. We see a little bit of a bump when the United States starts to experience an increase in cases. But if we were to move on to the economic shock frame, which is a new frame according to our analysis, what we see is that there is divergence in the prevalence of this frame across outlets. So the Wall Street Journal is talking a lot about the economic shock, but then outlets that are loyal to the current government, Fox News and Breitbart, seem to downplay this frame. Similarly, with political tensions, we see that Breitbart is very much discussing the political aspects of this and scandal and so forth, whereas more mainstream outlets like CBS or USA Today and others are not really discussing this outcome. Now, if we, I know I'm running a little bit over right now, but if I just have 2 more slides, if we were to look at the co-occurrence, so words that are related to that exist in sentences that have the term virus or coronavirus in it, I'm going to compare now the Washington Post to Breitbart. We see that in the beginning of the crisis, there's a lot of discussion of the medical aspects of the disease, but as we move forward, there's kind of a discussion of the pandemic in the United States and response. But if I'm to compare this to Breitbart, what we see is that China, Wuhan, and the communism in China and the government is central to the discussion, even going into April. So there's a lot of blame shifting here, and there's a lot of focus on the response of the Trump administration here. It's very politicized is my point here. So my last slide here, and I'm sorry for going over, is that we can see that, yes, indeed, there is, that there are frames that were in the past prevalent that we see here today, but we've seen emergence of new frames. But we also see that there are clear differences in framing by outlet, and that this is driven by ideology and partisanship of the outlet. And right-wing outlets supporting the government focus on blame shifting and otherness. And we have some points here about that this is early stages and that there's more work to be done here. I'm happy to discuss that in the Q&A.
Great, thank you so much, Constantine. Again, another very interesting presentation. We already are having quite a few questions coming in. I'm saving them obviously for later.